For people with type 2 diabetes, heart disease and stroke are the #1 causes of death and disability. But diabetes is considered to be one of the 7 major controllable risk factors for cardiovascular disease. In this report, Doug Johnson gets to the heart of the matter and looks at why it's so important to control diabetes.
Type 2 diabetes happens when the body develops a resistance to insulin, a hormone that helps the body use sugar as fuel. The body may also lose its ability to produce insulin. Both things can cause sugar levels to build up, which can lead to 2 problems. The cells don't get enough energy, and the sugar can cause serious damage to eyes, kidneys, and nerves. And doctors warn that it can also affect the heart, leading to plaque that can clog the pathways that carry oxygen to the heart.
Type 2 diabetes is a major risk factor for coronary artery disease. Now, just because you have type 2 diabetes does not necessarily mean you're going to end up having a heart attack. It's the lack of control of type 2 diabetes is what puts you at higher risk.
That lack of control can lead to hypertension or high blood pressure, and people with diabetes often have abnormal cholesterol levels. The problems can be worse if people with type 2 diabetes are obese, aren't active, or smoke. But people may not feel as if anything is wrong.
Diabetes doesn't hurt. Like having chest pain or headaches or things like that. So oftentimes it takes a routine physical to detect it.
There can be symptoms including polyphagia, feeling hungry, polydipsia, feeling very thirsty, or polyuria, going to the bathroom a lot. Type 2 diabetes can take years to develop and can happen to people who seem healthy. That point gained attention when Hollywood star Tom Hanks went on national television to announce he'd been diagnosed with the problem.
I went to the doctor and he said, you know those high blood sugar numbers you've been dealing with since you were 36? Well, you've graduated. You've got type 2 diabetes, young man. So, it's controllable and...
Dr. Castellaw says the problem can be diagnosed with a simple test that will show how the body is processing sugar.
There are important blood tests that your physician can do to detect type 2 diabetes, and one of the most important is a blood test called the hemoglobin A1C. And that test reflects how your blood sugar has been for the last 90 days. And that is a critical number for your doctor to follow over time, because that really is your report card on how well that you're doing with your diabetes.
If you're diagnosed, it's important to begin the process to control type 2 diabetes. It's when the problem is left untreated that major problems can begin inflicting major damage to the body.
When type 2 diabetes is out of control, then because of the high blood sugar that you have in your system, it is very atherogenic. And atherogenic means it increases the blockages in the arteries in your heart, in your brain, and to the rest of your body. So uncontrolled diabetes leads to blockages in those arteries and even hemorrhages in your eyes that can cause you to go blind. And if you have type 2 diabetes, the mainstay is always first diet and exercise. Oftentimes your physician will refer you to a dietitian. They'll sit down with you and carefully go over and map out a plan for you as far as your blood sugar control and how many carbohydrates that you should have in your diet.
Dr. Castellaw says medication, along with regular blood tests, may also be necessary to control type 2 diabetes and avoid problems with heart disease. For Smart Medicine, I'm Doug Johnson.